I'm Trish, and we're going to do some fluoride varnish. So I'm going to direct the camera down here. This is the type of varnish we use. It comes in a packet already. So I just need a little brush. Okay, so the first thing I'm going to do, this is Barbara. We're going to do some fluoride varnish on you today, Barbara, okay?
Okay.
I am going to place her down just a little bit so I can see better. You can do varnish laying back, or you can actually do it sitting up if you prefer. Sometimes if a patient is nauseous from this procedure, I'll usually sit them up because then they're not kind of gagging on it and they're not, they don't have so much saliva. So I'm going to take this, I'm just going to squeeze it in my hand like that, so I have all the fluoride there for me. I am going to dry her teeth off. So I'm going to do the bottom first. And before I apply the varnish, it's really important that you check the medical history so there's no contraindications, or if there's a food allergy or any dye allergy. In this case, Barbara, I already know her medical history is great, so we don't need to worry about that. You can swallow that. And I also want to make sure I explain to the patient what we're doing. Barbara knows we're doing fluoride varnish. Fluoride varnish is really great. It hardens when the saliva touches the tooth surface, so it stays on for a longer amount of time, so it's more beneficial, but it's also a protective, it's a preventative method for cavities. Okay? So I'm going to dry you up again. So I start on the bottom, I'll go on the top. Okay. So I take my brush, and I'll apply to all surfaces of the teeth, making sure try not to get the soft tissue. It's very sticky, it sticks right to people's lips, and most people do not like that, so try to avoid that. Okay. And I'm going to have Barbara swallow. And then we're going to apply on the top. This should take you between 1 and 3 minutes if you're doing it properly. Okay. And you can close and swallow. And then I'm going to give Barbara a cup, because we're not going to use the suction on this because it can clog your lines. So it's really important not to use the suction. And she's just going to spit out any excess that she doesn't want in her mouth, okay? So now for post instructions, you want to inform the patient not to eat or drink or brush or floss for half an hour. So that fluoride can do its job in there and absorb in the tooth. So then you're also not going to want to brush for about 6 to 8 hours after the fluoride treatment's done. And nothing too hard or crunchy or abrasive that's going to take the fluoride varnish off, because you want it to stay as long as possible. And the other thing is no hot liquids. That's going to kind of melt that away. Okay? And that is fluoride varnish.